Hi everyone, in today's video we're going to discuss what happens after your CBA and your SLA and what are the BCCNM decisions you might get after they receive your performance report from Inspire Global Assessment. If you're new to the process though, let's discuss what is the CBA and the SLA. First, CBA is computerized based assessment. It will test your theoretical knowledge through different clinical case scenarios. And this is something that you can do remotely. You don't have to do it in person. If that's something you want to do, just go to the Inspire Global Assessment website and it will discuss the step-by-step process you have to take to register for the remote CBA. So let's write that down. This one is theory. And something you can do remotely. Now let's discuss the SLA. The SLA stands for Simulation Lab Assessment, and this assessment, you need to do it in person, as this will test your hands-on nursing clinical skills. So this one, hands-on clinical skills. As I mentioned earlier, it's SLA stands for simulation. You will be put in different nursing case scenarios. You will be in the lab simulation room. You will have a patient. You will have a mannequin and you will have actors as your patients. And you will go through the step-by-step nursing actions you would do just like when you're in the hospital. For the nursing clinical skills, it will depend on the case scenarios you are given. Some of those skills might be medication administration. You will do focused assessments, nursing physical assessment. You might be asked to do a handover report. So that means if there's an oncoming nurse, you will give a handover report. You will be asked to do an S-bar to the doctor. That means you're calling the doctor. So let's just write down S-bar. Another thing might be discharge teaching or patient teaching in general. And of course, documentation. And these are just some examples of nursing skills you have to do. It might be less than this or it might be more than this. And that's why you have to be prepared for CBA, but most especially the SLA. Now let's discuss what happens after your CBA and your SLA. After completing both assessments, the CBA and the SLA, you will receive a single performance report that blends your CBA and SLA results. The report doesn't give you a score. It outlines specific competency areas where you excel and areas that may need improvement. This detailed feedback becomes the foundation for BCCNM's decision about your pathway to registration, along with your previous nursing education and nursing experience. This report will provide regulators or the nursing registry such as BCCNM with a true and complete picture of all your skills and competencies. The regulator or the registry, such as BCCNM, receives the report after applicants, such as you, have been notified of the results. The regulator or the registry, BCCNM, will directly contact you via email as soon as they have made a registration decision. Inspire Global Assessment doesn't make the registration decision. It would be the Nursing Regulatory Board, such as BCCNM. A question you might ask is, when would you get this report? It will take about 60 days or so to receive this report from Inspire Global Assessment. You will receive it via email. Now let's discuss the different case scenarios for the BCCNM decisions. The best case scenario is you will get direct registration eligibility. This means BCCNM may determine that you're eligible for direct registration without additional courses or any training. However, I want to note that this is very rare and this is less common as most internationally educated nurses need some form of education or clinical practice hours to meet the nursing standards of Canadian practice. So let's write that down. So that's direct registration. The second best case scenario would be TPE. TPE stands for Transitional Practice Experience. If you get this result, this means you did really well during your CBA and SLA. It indicates that you have strong foundational skills and knowledge, but BCCNM wants to evaluate your nursing clinical practice and ensure that you can safely practice as a nurse in Canadian healthcare settings. The TPE involves completing 250 clinical hours, and this will be supervised by Canadian nurses. So for the TPE, it involves doing 250 clinical supervised hours by Canadian nurses. And this is something that is needed for IENs, as during this clinical supervised hours, you will be able to work and see how it works in Canadian healthcare settings, in long-term care, in hospitals, in specialty clinics. This is not just you working, it's a learning opportunity for you to be mentored and coached by Canadian nurses while applying your knowledge and nursing skills in Canadian healthcare settings. Many IENs find this nursing experience invaluable. It's very important. It's essential as part of your Canadian nursing journey, as this is how you will build your confidence, your self-esteem, and also you'll be able to network with other nurses, with other healthcare teams, with the interdisciplinary team, which can work very well in your favor for future nursing job opportunities. The next case scenario would be you are advised by BCCNM to take some courses, some of them online. So you might be advised to take a number of courses. It might be 1 to 4 courses, around that usually, plus TPE. So 1 to 4 courses plus TPE or clinical hours. If you get this decision, that means there are gaps in your knowledge and your skills, such as therapeutic communication skills, maybe physical assessment, maybe LB documentation, depending on how you did, again, with the CBA and your SLA. For these courses, some of them are online. You do have to register yourself for these courses. If you're doing it here in British Columbia, some of the schools will be KPU, BCIT, and again, this is something you can do online, depending on which courses they advise you to do. The next possible outcome might be the Genie Re-Entry Program. The Genie Re-Entry Program is offered by KPU. Genie stands for Graduate Nursing Internationally Educated Re-Entry Program, and again, it's offered by KPU or Kwantlen Polytechnic University here in British Columbia. This decision indicates that there are significant gaps in your knowledge and nursing clinical skills. For the Genie Re-Entry, it is a 1-year full-time program. For the Genie Re-Entry, it will be online learning. There will be classroom classes, classroom theory classes. So this will be in person. You will go through simulation, so there will be lab classes, so lab simulation and demos. You will also go through clinical rotation, so practicum. The Genie Re-Entry Program, it's a comprehensive 1-year full-time course, and it is designed to bridge the gaps between the knowledge and nursing skills that you will need to meet the entry-level practice for Canadian nursing standards. The IENs who go through it say after that they feel more confident with their nursing skills, with their nursing knowledge prior to starting a new job in Canada. If you get this decision, don't be discouraged. See it as a learning opportunity that is needed for your success in working here long-term in Canada. For the Genie Re-Entry Program, you can't just register for this. You need a letter from BCCNM stating your eligibility to register for the Genie Re-Entry Program. There will be some instances that you might have to take preparatory courses, so you need to take courses beforehand before you can even register for the Genie. So again, it will depend on the BCCNM decision. The next possible outcome, this is something that as much as possible you want to avoid, you want to prevent. It's the most challenging scenario would be you need substantial education. Based on the CBA and SLA results, along with your nursing experience and education, they have deemed that there are significant gaps in nursing knowledge, in nursing skills, and you have to do a full BSN program and take formal nursing education. So formal nursing education, a full BSN nursing program. Again, we want to prevent this. You don't want this because that means you have to go back to nursing school, a full nursing school again. When you get this decision, it means that you haven't met the entry-level nursing practice and there are a lot of gaps in nursing knowledge and skills, and you are not ready to work in Canadian nursing workforce and even just taking courses. You need a full program. Again, this decision is very rare. Most of the time, IENs don't get this decision unless you haven't really practiced for a long time. You didn't prepare well for your CBA and SLA. You didn't do any preparation at all. And when you got there, when you did your CBA SLA, you weren't able to show those nursing skills and nursing knowledge that they need. To summarize, let's discuss what are the 5 possible outcomes after your CBA and your SLA results. First, direct registration. Second is TPE. Third, taking courses and clinical hours or TPE. 4 would be the Genie re-entry program. And number 5 is going back to a full-time nursing program. It's important to understand these potential outcomes before doing your CBA and your SLA, as this highlights why it's essential, why it's crucial to prepare before your assessments. The time and financial implication is a big difference, and that's why it's a wise investment to prepare efficiently, strategically for your CBA and your SLA. And as a bonus for you, how about we discuss some key strategies on how to do well for your CBA and your SLA and how to prepare effectively. To do well in your CBA and your SLA, good preparation is key. You need to know how nursing in Canada works, as it will be different from your home country, from the way you are practicing. So the first tip I have for you to prepare well for your CBA and SLA is to study the competencies that BCCNM expects from you. So study nursing competencies. Know what are they going to test you on. Second, know what to focus on in terms of nursing clinical skills that you will be tested on, such as medication administration, SBAR, handover report, documentation, and how that is done in the Canadian nursing way. That meets the entry-level nursing standards. Third, as you will be tested again in Canada, you will be practicing in Canada, use Canadian resources. Number 4, Canadian nursing practice is autonomous. What does that mean? You will be doing a lot of nursing actions and nursing decisions, sometimes on your own. And that is what the CBA and SLA will be testing you for. It will test for your critical thinking skills and your ability to make clinical judgment that demonstrates safe nursing practice. So for tip number 4, understand and enhance your critical thinking skills and clinical judgment. And my tip for number 5 is get good study materials that reflects Canadian practice. As I've mentioned before, effective preparation is key for the CBA and SLA. As the CBA and SLA, it's not a pass or fail. It's not something you can do again. It's not something you can retake. The CBA and SLA results, along with your previous nursing education and experience, will determine how close or far you are from getting registered and working here in Canada. Getting good study materials that reflects Canadian practice is a wise investment in your future. And that's why I created my IEN prep course for international educated nurses for CBA and SLA. As a Canadian nurse who have been trained and educated here in Canada, and someone who has taught internationally educated nurses for years and coach and mentor IENs, I understand exactly what you need to succeed. And that's why I created a comprehensive CBA and SLA preparation course for you. My course helps you understand Canadian nursing expectations, practice with realistic questions and scenarios, and help you build the confidence you need for success. I've helped hundreds of IENs achieve their goals, and I'd love to help you too. Lastly, before we end this video, I want to remind you that your nursing experience and your skills is valuable. What you bring to Canadian healthcare is important. The path might be hard, might be difficult at times. But with good preparation and support, your chances of success is very high. Every nurse, every IEN has their own story. Some take the quick path, some take the long path. Both are okay. What's important is you don't give up. I'm wishing you the best of luck, and I'm always cheering you on in your success. And if you found this video helpful, you're doing me a big favor by liking the video and subscribing, as this will help me create more videos for you in the future and create more content for IENs like you. Thank you for watching, and I'll see you in the next video. If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.